Maryland conditions as it relates to COVID-19 have been deteriorating in the last 3 weeks. Case counts have been climbing steadily since the 4th of July weekend. Sunday marked 925 new cases in one day, a milestone not seen since the end of May. Maryland hospitalizations, fortunately, have been trending only slightly upward. The Department of Health epidemiologists last week identified, a problem, identified 18 to 34-year-olds as a driving force in our recent trends, especially those who have been frequenting bars and restaurants. They traced many cases to those who frequented bars and restaurants where compliance with social distancing and facial coverings has not been rigorous. Positivity rates among this demographic were 84% higher than the general population, so it's substantially higher. Nationwide, the situation is substantially worse. Daily, our country is posting record numbers. Florida, Texas, Arizona, and California are leading with counts that are staggering. As a country, we are now in the midst of a surge in cases that was predicted when restrictions were relaxed in May. The situation is bad, and the models indicate that the virus is outpacing any benefits we might have accrued with the spring shutdown. Fortunately, Kent County has fared a little bit better than Maryland and other mid-shore counties, but we're not immune. Our case counts have risen significantly in the last week. Kent's positivity rate has doubled since I last reported on the situation. In April and May, cases were predominantly localized in nursing homes. Today, community spread outpaces facilities at a rate that is 5 times higher community spread. For me, the situation today is significantly more alarming than it was in mid-April. Kent usually lags other regions in our state, so I predict that the counts will continue to surge in the next 2 weeks. So if we can go to the first slide. The first slide is a total case counts in Kent County. The graphic is furnished by the town of Chestertown, and I want to thank them for the work that they've done putting this in. We have 223 total cases. Since I last reported to you, we have 25 new cases. The good news of the report today is we have had no additional deaths as a result of COVID-19 since June 30th. Our facilities, we've had 4 cases, 4 facility-related cases, 2 at the resorts at Chester River, and 2 at the Kent Center. The Kent Center is a new outbreak for us that we learned about on Monday. Community spread, we've had 21 new cases since I last reported. All told, out of the 223, 198 cases have been resolved. If we can go to the next slide. The new cases in the last 14 days, you can see that we've had 16 new cases in the last week, and this was as of Sunday, or as of Monday, today we have picked up 4 or 5 additional cases. So the trend is continuing upward. If we go to the next slide, this is just a comparison with the state of Maryland. As you can see, the important graphic there. Look at the yellow lines. The yellow lines underneath the blue. That indicates the positivity. The positive cases as we're moving through, and there has been a trend upwards since the 4th of July weekend. So speaking of positivity, if we go to the next slide, the red line indicates positivity rate, 7-day positivity rate for Kent County, and the blue line indicates the statewide rate. As you can see, for much of June, we were well below the state average, and we have, just recently in the last week, we have come back up to the state average. Today, our positivity is at 4.9%. So that means that just about 5% of those people that we test end up being positive. We have, if we go to the next slide, how many of our folks have we tested? Kent County is doing well. We are third highest in the state for the percentage of population that we have tested. We're currently at 17.1%. So I guess what I wanted to talk about here related to our most recent cases, what we have found from contact tracing is that 6 of our cases occurred in 2 family units that had participated in family gatherings over the 4th of July weekends. 3 of the cases occurred in people who were cohabitating. They're unrelated, but they were cohabitating with each other. 2 cases were related to occupational exposure, and 10 of the additional cases were of unidentified origin, which is the most difficult. So we try to track down where did the individual come into contact with someone who was positive, and where do we think they got it. And for 10 of the 21 cases, we could not find a direct link with someone. So that is typically an encounter that's happened in the community, or that they've had with another person in close contact. And as I noted, the community spread rate is going up significantly, and it's very as we're encountering more cases where we don't know where it came from, it becomes more alarming. Just to give an overview of the race information related to our positive cases overall. This is Kent County cases overall. We have seen higher than expected numbers in the non-Hispanic Black community, and we've also seen substantially higher numbers in our Hispanic community. The members of the white community, Asians, others, and we have about 10% where data is not available. So let me just talk about our community testing. At this point, we have tested 774 individuals since we have transitioned back to testing locally in Kent County. Our positivity rate is at about 5%. It's a little bit above the state average. When I talk about hospital capacity, the University of Maryland Shore Regional, Chestertown has seen an increase in admissions and ICU utilizations in the last 3 weeks. Fortunately, they have not needed to mobilize their surge capacities as far as I know. To briefly mention our nursing homes, 2 facilities have successfully entered the first phase of reopening. That would be Heron Point and Peak Healthcare, and the good news is Heron Point will be eligible to enter the next phase of the relaxation of restrictions on Thursday, and we're hopeful that we can get that moving forward for them on Thursday as well. Our testing site, we moved from the Public Works building on July 9th to our office-based testing strategy on Washington Avenue. We're able to test approximately 65 people a day. We're doing it 2 days a week currently for a total of 130 tests a week. The demand for tests is increasing. We are regularly filling our daily slots, and results, fortunately for us, results typically take 2 to 3 days to return. And for many jurisdictions who use large national labs, they have experienced substantial delays, 10 to 14 days to get results, and that's just unacceptable, because why even bother testing if you can't get results back by the time the quarantine period has been lifted. Okay, so the health department, the Kent County Health Department testing strategy, we want to do it in two ways. We want to have an office-based testing location that we have now, and we also want to have a mobile testing capability where we can go out and respond to hotspots. We were in the process of hiring 2 nurses to staff the mobile unit. Unfortunately, they backed out at the last minute, so we're going to have to go back to the drawing board on that one, and hopefully we will have a solution in place by the next time I address the community. The good news related to testing is that the University of Maryland Shore Regional Health has decided to open its own testing facility at Chesapeake College for the 5 counties of the region. They are stepping up to provide community testing. The health department is encouraging that activity. We are supporting them by providing contact tracing and notifying people who are tested with their results. Our contact tracing staff has been augmented by 2 individuals since we last spoke. We're finding that community spread cases are typically much more complicated than those that are in facilities. One of the trends that, as I mentioned, that we're seeing is a younger demographic, and we're also seeing it in individuals who are visiting family members in small social gatherings. So the cases where we are able to identify where the exposure happened, many of them have happened in family gatherings or small social gatherings where they're not expecting. It's not large crowds. It's not necessarily bars and restaurants, but at picnics and barbecues that happen over the 4th of July weekend. I want to briefly mention enforcement activities. Last week, the governor sent county leaders, called on county leaders to increase enforcement activities related to face coverings and social distancing in retail establishments. The health department has a plan to hire a dedicated enforcement staffer to work with our environmental health staff using our CARES funding. And we're looking at reassigning one of our drivers for adult daycare, who is a retired state police officer, to help us do those enforcement checks. And we're interested in working with the county and the alcohol control officer, Mr. Ober, to increase our presence and do spot checks on the street, because we really think that that is important to help minimize the spread of this virus. Just a brief update on CARES funding. At this point, the health department has paid out a little over $215,000 of invoices for county and municipal public health spending. Just a reminder to encourage all of our agencies moving forward to proceed with the spending and do the approvals as you're well aware. Just wanted to give you an update on where we were with spending the money. The health department at this point, our CARES spending is significantly higher than we expected. We've had to hire staff for testing, contact tracing, translators, and also for our enforcement person, and that's higher than we originally anticipated. So what I want to talk about now is the health department's immediate challenges as we go into this period of rising cases. One of our biggest challenges right now, and one of the hottest debates in the community, involves school operations. Schools open in approximately 4 to 5 weeks. Many of the details about how this is going to happen are still pending. Infection control and outbreak response procedures are still in the early stages of development. The school health program that is run by the health department has been chronically understaffed in just normal years. This is not a normal year. We've made a request in February for additional personnel and we were denied. Outbreaks in the school setting this year will likely overrun our capacity in the school health program and will require the health department to stop its regular services to free up our staff to respond to schools. At this point, I would strongly advocate that Kent schools proceed with an online learning for the fall semester. Washington College is also another challenge. It's coming back online in September. They plan to bring 846 students onto campus starting in August, with 200 more living off campus. Fortunately, their testing, quarantine, and isolation procedures are in the final stages of development and likely will be published shortly. In-person education at Washington College, from a public health perspective, represents an influx of the most mobile and infected demographic that we have right now. So, our community is going to need to be aware of the movement of students and being very vigilant about face masking and social distancing. The 1,000 or so students we're talking about represents a little over 5% of Kent County's population, and it is, we're partners with the college. We want them to succeed. We want to have the students in the community, and I think that they're doing a very good job of structuring how they're reopening with their living accommodations and their infection control practices to minimize the risk to the community. And then finally, our ongoing immediate another challenge that we have is encouraging citizens of the relevance of face masks, social distancing, use of hand sanitizer, and responsible personal choices. It's all about responsible personal choices. We routinely field calls about folks who feel that face coverings and social distancing are an imposition, when, as the evidence shows, it is beginning to gather that those methods really do work. In closing, I just want to say that we're early in a new surge of cases. Reimposition of statewide or federal restrictions are unlikely. Kent County may have to consider imposing restrictions and regulations in the absence of outside leadership. We face many difficult decisions about opening schools, allocating our testing resources, and ensuring our healthcare system can cope with the surge. Evidence is growing that face coverings make a significant difference in the transmission of the virus. As leaders, we need to double down on their necessity in spite of waning popular support. Local action may be needed if conditions get worse. Our community's success with the actions and personal responsibility, our community's success will rest with the actions and personal responsibility everyone takes. I urge all to please continue to wear face masks, stay at home if you are at high risk, wash your hands, and keep your distance while you're socializing. Your efforts make a difference. These measures work. Thank you.
Mr. Webb, didn't they all, 4 or 5 counties today make some change, like Baltimore County, I think, and some of them made some changes as to their operational policies with maybe doing away with inside dining and stuff? So
the one that I'm definitely aware of is Baltimore County has mandated indoor face coverings in indoor public spaces. So, it's more than just retail establishments. It's recreational facilities. It is office buildings. It is, anywhere where you may be inside, and it's not a private space. I know that the health officers in the central region of the state sent a letter to the Deputy Secretary of Health urging the governor to take statewide action to roll back some of the relaxation of restrictions. They have seen a significant increase in cases, and the problem is with this particular virus, when you get infections, it's exponential growth, and it goes up a little bit and then it spikes way up. And my colleagues really do feel that they're right at the beginning of when it's going to go significantly up, and that's why they're asking the governor to make those changes. I know that locally on the Midshore region, Queen Anne's County has had to close a number of restaurants in Kent Narrows because of infections, and in Talbot County they have seen an increase in cases, and just today there was a cluster of 40 cases in Dorchester County, and I have not gotten additional information yet about what that involves.
You said the University of Maryland's going to open up testing at Chesapeake College. Are we still going to continue our testing here?
Yes.
So it'll be 2 places.
Yes. We need all the capacity we can get,
Right.
and one of the strategies that has been discussed in public health circles is the process called batching tests. So essentially, you swab everybody who lives together in a building, and then it's one test that's run from the solution that they get out of the bottom of the test tube. And if it returns a positive, then everybody who's in that residence is considered positive, where they do additional testing. It's a way to increase the amount of testing without needing additional testing supplies and reagents that are in short supply.
So how do they count those? If you have 5 people in a house and you're swabbing everything together, then are you reported, does that get reported as 5 positive, even though it may not be 5 positive?
So that what happens is that then you do a second round of testing.
And the second round is when they individually
Correct.
test everybody. And then they would count that one.
Correct, and when, right now, our positivity rate is only about 5%, so it helps, if you have a group of negatives, then it helps rule out those individuals so that you can really focus on those who have infections.
Okay, well, that makes sense, because then you
test 5 people with one test, and if they're all negative, then you can see these other tests for another group that
may be positive.
Correct.
I was just making sure that, I was just curious if they were counted as, but they're not.
They're followed.
They don't count them until they do the follow-up where they